Broadcasting from New York City to the world, it's the G-Man Interviews.
Welcome. In December of 2015, the G-Man Interviews revealed that home health aides in New York State are not properly trained, vetted, and fail to provide quality care for many of their patients, especially those afflicted with Alzheimer's, Parkinson's, and other debilitating diseases. The episode also exposed the fact that a good number of home health aides and personal care nurses come from other countries and are not able to effectively communicate with their patients. This was clearly illustrated in the example of a Russian home health aide that was assigned to care for an 80-year-old black woman with Alzheimer's. The aide did not speak English, and the woman's daughter was forced to call the aide's employer to have them translate how the patient's meal should be prepared. Prior to and after "I'm scared these home health aides will kill my mother" was posted online, home health aides were arrested and convicted for theft, and owners of home health care agencies were charged with Medicaid fraud. In this installment, Monica ARROYO-HORNE returns to provide an update on what she calls a blatant and ongoing pattern of incompetence and neglect by home health aides that have been assigned to care for her mother, who suffers from Alzheimer's. Thank you for joining me once again, Ms. ARROYO-HORNE.
The pleasure's all mine, G-Man.
During a recent phone conversation with the G-Man Interviews, you indicated that there have been major developments since your episode was posted in December of 2015. The first of which involves a letter you received from the state of New York. Could you provide some details?
Well, since the last time I was on your show, I received a letter from the New York State Department of Health in regards to the complaints I filed against about 3 agencies. And the New York State Department of Health informed me that they did do an investigation against those agencies, and that they did find them in violation of a portion of Title 10 of the New York Code's rules and regulations.
Did the letter stipulate, or do you know what Title 10 is?
Actually, no, I really don't, because I tried to look on, to go on their site to see exactly what it means, but I wasn't clear as to what it means exactly.
Would you say the explanation wasn't very detailed?
Yes. So each agency I filed a complaint against, they were all found in violation of the same Title 10 code.
Did the letter or subsequent conversations with state officials indicate whether or not fines would be issued or if the agencies would be reprimanded?
Well, according to the letter, it doesn't indicate that. It does, however, say that they have been spoken to, that they brought my concerns to the agencies, and they're advising them to retrain the aides. So it doesn't say anything regarding them being fined, but that's as far as it's been, and I haven't heard anything since then.
Have the agencies responded to you regarding the complaints?
Not one of the agencies have responded to me personally. I've had a little conversation with them after the complaints were filed. I didn't feel a need to personally contact them because they were no longer employed with me, but after the allegations were made against them. So I basically kept my ear open to hear what I can hear from the New York State Department of Health.
You also alleged that there were, quote, other deeply disturbing incidents involving home health aides. Could you explain?
This month I had approximately about 4 aides here from the period of I believe they were here from April the 13th up until the 17th of this month. What happened was the first aide that arrived as a replacement, she informed me that she was unable to push a wheelchair. I had requested that the young lady take my mom outside because it was a beautiful day out. And I asked her if she would be kind enough to take her outside and let her get some fresh air as opposed to keeping her closed up in that room. Well, the young lady began to tell me that she does not push wheelchairs. And I asked her again, I said, excuse me, you don't push wheelchairs? She says, no, I don't. She said, the agency knows that I was involved in a bus accident with a patient on a wheelchair who happened to have been on the accessoride. And due to that, she injured her back, so she doesn't do any pushing of wheelchairs. She doesn't do any helping a patient to get in and out of bed, etc.
Isn't that a crucial part of your mother's care?
Absolutely, absolutely. My mom relies on the aides 99%. And all they have to do is stand my mom up. She will actually walk. She walks very slow, but she will walk if you hold her hand. And this particular lady said that she was unable to do that. So I asked her immediately if she had called the agency, and she said they know. And then when I called the agency and asked them, they said they had no knowledge of that. And therefore, she would have to come into the HRA department and bring doctor's notes to prove that.
What happened in the second case?
So the next case, then I had an aide that came in, and this particular aide told me that she doesn't do any housekeeping. So what I found was when I arrived home from work, I walked into my mom's room like I normally do, and I greeted her. And what I found was food on the floor and portions of her soiled diaper, the cotton part, bowls of cotton of soiled urine on the floor. So I asked the aide, was she going to clean that up? And she told me that she doesn't do any housekeeping.
Was that part of her job description?
Absolutely. That's part of the care plan. The part of their care plan, each agency provides a care plan for the aides that arrive to their assigned case. And particularly if you're dealing with one agency, their care plan never changes. It remains the same, and it's stuck on the refrigerator, so the aides, when they arrive, they can look at it, view it, and see what their responsibilities are. And one of the responsibilities are to clean up behind the patient. That means cleaning her floor, mopping her floor, sweeping her floor, etc. This particular aide said that she doesn't do that. And I found that very strange. So then I asked her, I said, well, if you're not going to do it, who is going to do it? Because, it's been there I don't know how many hours. And she just stood there, and I told her, I said, ma'am, unfortunately, you have to clean that up. And she began to clean it up, but she was reluctant to do so. Then the next case was I had a young lady here on the 17th of this month. This young lady came in. I greeted her at the door, and since I had been having situations with a few aides prior to her arrival, I asked her her name, I introduced myself, and I asked her, was she going to give me any problems with caring for my mom? And she said, absolutely not. So with that being said, I showed her where the kitchen area is. I showed her where the care plan is. She put her things away, and she went into the room. And I went to bed. I didn't give it a second thought. When I woke up the next morning, what I found was my mom soiled from her nape of her neck to her thigh with urine, where this young lady had not changed her throughout the night or that morning, which is part of her job because she's a living aide. So when I woke her up and I asked her, I said, ma'am, excuse me, she's soaking wet. She began to argue with me, and she got up and she sat on the side of the bed and she pulled out her phone and she called the agency. And that's when I asked her, I said, who are you calling? Are you calling someone to help you to change my mom? She started yelling at me, and she told me, I told you when I came that I wasn't going to be able to do this. I cannot change your mom. You will have to help me. And then I began to explain to her that I have to go to work. There's no way I'm going to be able to stay here and help you. I'm going to be late for work. And unfortunately, she left.
Did the agency tell her to leave?
No, they did not tell her to leave. What they instructed her to do was to change the patient. But this young lady chose to just be on her way, which resulted to my having to miss a day of work once again.
Doesn't New York State law indicate that no home health aide can leave a patient until a replacement worker arrives?
That's correct. That's correct. And what I find is that a lot of them do, but what I found most intriguing was the fact that during the same month, a coordinator from one of the agencies had instructed one of the aides to walk out and leave my mom. And I literally got on the phone. When I saw the aide packing up her things to leave, I literally got on the phone and I asked the coordinator, who happens to be the coordinator supervisor, I said, why is she leaving? She says, well, she has to go. She can't stay anymore. There's no one. We can't find anyone to fill in for her, so I have to release her. I said, well, then who's going to take care of my mom? Because I have to get up the next morning at 5 and go to work. She told me, and I quote, well, you're there. We'll work on getting somebody, and no one ever showed up. And this was from a supervisor.
Were all of these aides from the same agency?
Yes, they're all from the same agency.
How did the agency react when you called to make them aware of what was happening?
when I was able to get through, let me be clear, calling this particular agency is not an easy task. I have called this agency on a certain hour of the day. Let's just say, for example, I'll start calling them around 1 o'clock. From 1 o'clock all the way up until about perhaps maybe 2:30, I'm on hold before I can actually talk to someone. And then when they do pick up the phone, then they put you on hold, and they say they're going to transfer you to a Brooklyn supervisor. And then I'm on hold for another 30, 40 minutes. And with that being said, once I do get through to speak to someone, it's often an on-call supervisor. And they pretty much just all say the same thing. Well, I'm sorry that you're having this problem. We're going to definitely call her in, and we're going to send someone else if I'm without an aide. Or if I'm fortunate enough, I get to speak to the coordinator of this case, and she will tell me the same thing pretty much, and they apologize, and then they'll tell me they're going to try to find someone else. But each time they always reassure me that they're going to call the aide into the HRA department and have a conversation with them.
There was an aide who accused you of theft. What happened in that situation?
Recently I had a young lady here. She came in the morning, and I was at work, and because I have cameras, when I have new aides, I like to observe them while I'm at work when I get a chance. Upon my arrival home, when I came home, I found that the young lady had not done too much for my mom. So I asked her, I called the agency after I viewed the tape, and I told the agency beforehand that once I got home, I was going to release her. Well, when I got home, I did exactly that. I spoke to her. I asked her why she hung up the phone on me twice that morning, because I was actually trying to call her to give her some insight on how to care for my mom. So she was very rude. She hung the phone up on me twice. So upon my arrival home, I went in and I introduced myself. I told her, I said, I'm the patient's daughter, Monica Arroyo, and I spoke to you today, and you hung the phone up on me. And with that being said, I asked her to just get her things together and just leave. Well, she was reluctant to leave. She told me that she wasn't going to leave, and that anything I have to say to her, I can call the agency. She told me again, she says, well, ma'am, she says, I'm here for your mother. I'm not here for you. And when she said that, at that very moment, I realized that she must not have realized my mom had no conversation with her throughout the course of that morning all the way until that afternoon, because she has Alzheimer's. She doesn't really talk. So, again, I asked her to leave. And one thing led to another. We got into a little verbal argument. And then she began to accuse me of taking her $1,000 and her car keys from her bag. Her bag was on the doorknob at the front door of my apartment because I told her it was time for her to go. As I placed her bag there, and I told her, please, your bag is outside on the door. Just take your bag and just leave my house. Now, her reasoning why she was trying to do, just accuse me of taking her money, I have no idea. But I do know that she began yelling and talking about I took her bag, and she even called the police.
She called the police?
She called the police, and everything was on video. And when she called the police, her first thing she told the police officers, I was standing in the room with her, she said, the patient's daughter arrived here, and she hit me and took my $1,000 and my car keys. And I don't think she realized that the camera was right there in the room during the whole incident. So the police arrived. They got her bag for her. I asked the officers to please check her bag and make sure she has her $1,000 and her car keys. They checked her bag. They found that she had everything, and they escorted her out of my apartment.
Okay, to be clear, the police examined the contents of her bag and confirmed that the specified amount of money and the car keys were in her possession before escorting her from the apartment.
That's correct. But what I found to be so ironic is about 35 minutes later, the agency calls me, the same coordinator that asked the other aide to leave my mom without service. She calls me on the phone and she says, Miss Arroyo, the aide cannot find her car keys. Do you have her car keys? This is a serious accusation if you have her car keys. And I said, why would I have her car keys? And I told her, I said, I do not have her car keys. And if she wants to come back with the police, if you're recommending that she call the police again and come back to my apartment, they're more than welcome to come in and check and see if they can find car keys. And officers did come, but not on their call. They never made that call. They never called the police a second time. But I did call the police the second time, because I have to protect my job because I work for the city of New York. So when the officers arrived the second time on my call, they came in, they canvassed my whole apartment, every area where the young lady was, and they found no car keys.
If she alleged you took her car keys, how did she get home?
That was my question to the coordinator, who called me the following day. She called me the following day, this same coordinator. And while she was talking to me, she was explaining to me that someone was coming over. She was telling me what aide was going to be arriving to my home, which I requested they let me know the name of the aides. And while I had her on the phone, I asked her that question. I said, did the aide ever get her car keys, or is she still out in the area looking for her keys? And her response was, I don't know. You tell me, do you have them?
As a result of these incidents, you've taken action in order to expose the agency, its aides, and to make sure they're held accountable going forward. What did you do exactly?
Yes, that's correct. I recently contacted the Office of the Inspector General. I sent him a letter, not only regarding this incident that occurred, I sent him a letter in response to all the complaints I filed within the last year. And what I did was I listed all the complaints by their numbers that were assigned to each complaint, and I explained to the Inspector General that I wanted this investigated because this is an ongoing situation with the aides. They come inside my home, they either don't have ID or they're completely unskilled or they just don't want to work. And they leave my mother in dire straits, and I can no longer deal with this. This has to stop. So when I wrote this letter, which is dated April 20th, 2017, and after talking to them on the phone, I did forward this over via fax to their office. And the young man that I spoke to, he said that he was going to forward it to the appropriate office, which is the healthcare division, and that it will be investigated. I did let them know that I had written letters also to the Department of Health regarding some of the same issues that I've been having over the last year or so. And I wanted to also fax forward copies of that to this office as well to let them know that I have been trying to get the home health care agencies and the aides that work for these people so that they'll see a lot of these women are not skilled. And so many of them come on these cases thinking that it's a patient here or a client, if you will, that need a companion. They don't need companions. They need someone that's going to help them to their daily life, help them through their daily life ventures, going to the ladies' room, preparing their meals, taking them outside for fresh air. So I'm hoping to hear something from that office very soon. I will be following up next week.
You also alleged that one of the aides, whom you described as one of the better ones, told you that an agency representative warned, "Watch out for Miss Horne." Please explain.
Yes. What I've discovered recently was that one of the aides had informed me that before she came to this case with my mom, they kind of give her a heads up on how I am as a person. And what they tell her is that I'm very demanding and that I pay particular close attention to my mom's care, and also that there's video cameras in the house. So a lot of the aides that come here, most of them, come to the door on a defensive mode. They're ready to attack if I say anything, if I try to give them any instructions whatsoever. And I found that this has been going on for some time now, not only with this agency, with several agencies. They tell them about the daughter. They tell them nothing about the patient. According to the home health care aides, they said they're not allowed to know anything about the patients due to the HIPAA law. But what I found ironic is that they know more about me, or what they presume to be correct about me and my persona. So when they come in, they normally, if I say something to them, and I try to greet everybody the same way, I give everybody the benefit of the doubt that they're here to do their job, they're going to take care of my mom, they will come in, and once I give them some instructions, and if they don't like it, then they'll start an argument with me. And then that leads to them either being dismissed or replaced for that day.
If what the aide told you was true, and agencies aren't informing their aides about the client's medical condition because of the HIPAA law, how will they know if they're emotionally, mentally, or physically capable of handling the assignment or rendering quality care, especially if they're dealing with someone with schizophrenia or other mental disorders. Did you ask anyone at the agency about that?
I asked them about that as well. They only told me that due to the HIPAA law, they can't tell these ladies what the patient's condition is, and you're absolutely correct. Because most of the young ladies that report to my home, they don't know that my mom needs someone to help her stand up and to change her adult diapers. So the agency has not been willing to discuss that matter with me whatsoever.
This has been the case with the agency you're currently using or most agencies?
Most of the agencies. Most of the agencies have the same rules. They do not make the home aide aware of the patient's condition. And I can give you an example. I did have an aide here a few years back, and she said she wasn't informed about the young man that she was assigned to take care of condition. And unfortunately, when she got there, she saw this young man. He was in bad condition. He was a young man. He was in very poor condition where he had no buttock area. And she said that she was unable to take care of him because she kept getting nauseous, trying to just change his diaper. So I don't know what their reasoning is behind that, because I really believe that they should make these aides aware of the patient's needs. And unfortunately, they do not. And I've heard this from every agency.
On more than one occasion, you stated that you were challenging home health aides and agencies in an effort to protect your mother and inform the public of what was going on. In addition to what's been presented in this discussion, you allege home health agencies may be defrauding the city and state. What would you cite as evidence?
Well, what I discovered was that a lot of these home care agencies, they seem to welcome their aides committing fraud. On one occasion recently, I had an aide that was here who told me that she was unable to care for my mom. So basically, this lady was not able to change her diaper, feed her, get her in and out of the wheelchair. So what I said to her, I says, well, if you're not able to do this, then you need to clock out, because you're being paid by the city or state to take care of this person, and you're not able to do it. I insisted that she clock out. She then, she did clock out, and I told her, I said, the only thing is that you will have to wait until someone comes to replace you. So she immediately called the agency and told the agency that I insisted that she clock out. Well, one of the coordinators from the agency got on the phone with me, and she told me, you can't ask the aide to clock out. And I said, why not? She's not working. She says, well, she's still there, so until we send a replacement, you can't ask her to clock out. And I said, well, it's been my experience that when the aides report to work at 8 o'clock in the morning, I said they clock in to let you guys know that they're here. And then when they clock out for the evening after they've finished their assignment, then they clock out using codes stating that, and these codes have individual assignments that they might have done in the course of the day, like cleaning the patient or taking the patient to the doctor or the grocery store. So there's different codes that they have to push. And this is what the agency goes on as far as them completing their task with that client. So therefore, I said to her, well, if the aide didn't do anything all day and she's literally sitting here holding her pocketbook, not working, I said, are you promoting fraud? And she says, no, I'm not promoting fraud, but since she's there, she has to remain on the clock. I said, well, under the guidelines, I said, I do believe that even though she's here, she's not working. I said, so if you're telling her to clock back in and not work, that's fraud, because my mom doesn't need a companion. She needs a home health care aide to take care of her. And so the coordinator and I began to have a debate on the phone about it, and I said, well, this is how it's going to be. I'm sorry, but she has to clock out because she's not working. I'm actually doing the work. And I said, unless I'm being paid by the agency, I can't allow her to be clocked in and not working.
And finally, you claimed all the aforementioned incidents took a significant toll on you in 2016 and the beginning of 2017 in terms of your employment and efforts to obtain your master's degree. How so?
I work full-time, as I had mentioned before on an earlier episode with you. I work for the city of New York, and I have to be at work at a certain time. So due to the inadequate home health care aides I've had over the last 2 months now, I've missed work, which has cost me, of course, money and time. So what has happened is when I don't get an aide here, I cannot leave my mom alone because it's against the law because she can't take care of herself. So I'm forced to stay at home and to take care of her and wait for an aide to report here. And oftentimes they don't come right away. I've had an aide report here 10 o'clock at night to work, which I'm happy to see them, come at all because then that gives me an opportunity to report to work the next day. Technically, I'm supposed to have live-in 24-hour service for my mom, where an aide is supposed to be here for 3 days and another, they can split the shift the other additional days, but she has 12 hours, 24-hour service. But unfortunately, the agency that I have, they inform me that they don't have live-in aides right now, so they're always searching for a live-in aide. So this young lady that did show up after I missed a day's work, she came in at 10 o'clock that night. And, of course, my mom is sleeping at that time, but I try to show her, around the house and the things that she can have access to, to take care of my mom. And then I normally just go to bed. And another thing about not having the aides here on time or a scheduled aide, this month I had to take final exams. And unfortunately, I didn't have an aide to take care of my mom. And I was calling the agency the night before. I called several times asking them to please have someone here. And because they weren't able, or they did not provide me the service, I should say, because they do have aides, I had to miss my final exam. And since I pay out of pocket for school, that hurt me a lot. Not only, first of all, it hurt me because I missed my final exam, and then it hurt me because financially it hurts me. So that was a very unfortunate situation for me. And, it's just not easy. These aides have all the ability to walk out on jobs. They can rob the patient's family and the family members and the patient. They can do anything they want, and nothing is done to them that I see. And I did have a conversation just 2 days ago with a coordinator at this home care that I'm with now, my mom and I asked her a simple question. I said, when your aides are found doing things unprofessional in the homes of your clients, what is the reprimand? And this woman told me on the phone, clear as day, she says, well, we do reprimand them. We bring them into HR. However, how we reprimand them, we cannot let you know. That's their personal business. So then I told her, I said, well, then you're telling me that. You could just tell me that you're bringing them in, and one, they could never come in. You could never ask them to come in. As far as I know, you might just send them to another case. How do we know that there's some satisfaction if an aide comes in and robs my mom or takes something and I catch her on camera doing it and I call you and report it? How do I know that you reprimand them? And she told me that she's not privy to give me the information about that.
Is there anything you'd like to say in closing?
Well, the one thing I want to say in closing is this. This has been going on with me for several years now with my mom's home health care aides. And I continue to fight. I am continuing to fight to ensure that these aides that come into our homes to take care of our loved ones get the proper training. And I really have to say, I'm reaching out to anyone and everyone that can help. Let's fight together and get these elderly people the help they need, especially those who want to stay at home, because they should be allowed to stay at home. And if they are going to be at home and they require home health care service, they should get home health care service to the best of their ability. We don't need aides that's going to come in and just want to plug in their phones and sit down and watch TV while the patient sits there and suffers and laying in their urine and their feces. That's not right. I think the governor has to step up. He has to change some laws and rules and regulations, and it needs to be done now. This can't continue to go on. We've saw so many people in the media, elderly people being hurt, abused, some even being murdered at the hands of home health care aides. This is insane. Like I've said to many of the agencies and the coordinators and supervisors, it's just so heartbreaking to know that these women come in and their only interest is clocking in, plugging in their phones, and getting a paycheck. They don't care about their patients. And I think the whole industry, home health care, should be changed. It should not be, the word care should not be in there at all because they don't care. And the family members like myself, the only daughter of my mom, I have no one to help me. It's not fair to me that I have to lose work and time, and police are running in and out, disturbing my home, and even frightening my mom. We have to keep on these home health care agencies and make sure that they hire the proper people to do this job. And if it doesn't happen soon, I can clearly see myself soon just marching in front of Washington with a sign. I can no longer deal with this kind of interruption in my life, and I don't want my home interrupted. I want my mom, who's 83 years old now, I want her to be able to live her life. And, you know, she's living the last chapters of her life, as I said before. She shouldn't have to have all this disruption around her home. I love her, and I don't expect these ladies to come in and love her, but I do expect them to do their job and to care. That's all I'm asking.
I won't go into detail, but I know how difficult it was for you to take part in this interview. I really appreciate you returning to provide an update on your situation.
I thank you for allowing me to come on the show again and explain it, and I hope this really reaches out to the people that it needs to reach, and we start changing some things.
Thank you for joining me, ladies and gentlemen. Until next time, stay cool, stay safe, and stay informed.